So Self-Management BC is a Ministry of Health Patients as Partners initiative administered by the University of Victoria. The self-management programs were developed at Stanford University, have been implemented in 25 countries worldwide. Here in BC, we started the programs in 2000, and since that time have trained almost 5,000 volunteer leaders who have delivered workshops to over 25,000 participants. They're evidence-based programs evaluated extensively, and a recent meta-analysis of the programs have found that people who take the program usually report having more energy, less fatigue, an improvement in their health status, higher self-efficacy to manage their disease and other symptoms, less pain and health distress, less depression, less limitations in their social roles, better communication with their doctors, and better planning skills. So what is self-management? It's the tasks that individuals must undertake to live well with one or more chronic conditions. So it includes the confidence to deal not only with their medical management, but also their role management, their day-to-day functioning and their conditions. Hurrying along here. So self-efficacy is associated with health outcomes. It's not just having knowledge or skills, but it's about your confidence and a belief in your ability to use those that leads to the positive health outcomes. And a number of strategies employed in the workshops to achieve those: mastery, learning, modeling, having the leaders be people with chronic health conditions and so on, reinterpreting symptoms, and social persuasion. So an overview of the chronic pain self-management program. This is the workshop overview, what takes place in this 6 weeks. It's not intended to replace any treatment or regular patient education. It's self-referral. Family members, friends, and caregivers are welcome, led by pairs of lay people with chronic health conditions. No cost to attend. Participants are learning to problem solve, to make decisions, how to use resources, to set goals and take action, how to develop an effective working relationship with their doctor and other healthcare providers. Highly interactive, groups small. The workshops are 2.5 hours, once a week for 6 consecutive weeks, usually 10 to 16 people together. The courses are delivered in community settings. The leaders are trained in a 4-day workshop and deliver the program using a scripted leader's manual. They receive the resources that the participants receive is a copy of the Living a Healthy Life with Chronic Conditions book, a chronic pain workshop book, and the Moving Easy program CD. Okay, so what's important for you in terms of the role of the healthcare provider? Linking people to these community programs. Only 25% of people with chronic health conditions are referred to community self-management programs by healthcare professionals, and yet the probability of a person actually attending one of these workshops increases 18-fold if it's recommended. So. I just want to mention, in addition to the chronic pain self-management program, we offer the chronic disease self-management program, diabetes self-management, arthritis, fibromyalgia, and active choices. Just want to talk about an example. Bruce, 57 years old, lives alone. This is a participant that attended our program, enjoys nature and dirt biking, experienced a motorcycle accident and damaged nerves in his legs. He describes his pain, also reports he's worried about his health, his future, is overwhelmed, feeling depressed and vulnerable, didn't like the way it was affecting him physically and mentally, becoming an angry person, and starting to use drugs and alcohol. He saw an ad in the paper, noticed that it was offered by the U of Vic and the Ministry of Health, which instilled confidence in him. He called to register. He had some initial impressions positive about the course, thought it would take him a lifetime to learn all those things himself, saw that other people were managing their pain. That gave him some perspective and some hope. And as a result, becoming more proactive with his medications, learned some techniques to help stay calm, to manage migraines, and that the techniques were things he could apply in his everyday life.